what we had learned in the last class and then move on to next sections. So in the last class, we had learned about information overload and the possible negative consequences of information overload. So to begin with, information seeking strategies in public health, we had discussed a quote that of all the sciences, public health has the most diversity. That is, it has diversity in its subject matter, its audience, and its workforce. And therefore, because it has so much diversity in its subject matter, its audience, and its workforce, therefore, its information needs are also diverse. There is a lot of diversity in its information needs. Now, in 19th century, there was a famous Irish dramatist named Oscar Wilde. You all must be knowing him. He had said in as early as 19th century that it is a very sad thing that nowadays there is so little useless information. What he was referring to is that was the sea of information that we are all inundated in. And the problem is that we do not know what part of the information available is useful for us and what part of it is useless for us. That information might not be useless, but for a person, a specific person, it might be useless because he or she either cannot understand or cannot process or use that information. So here I would give you a small task that please, whenever you come across any famous figure of 19th century, please note down his or her birth and death dates and calculate the lifespan of that person. Do this for some 10 to 20 famous figures of 19th century, and then we'll calculate the average lifespan of these famous figures who belong to 19th century. This I'm giving you for a reason. Please do this task. Whenever you come across any famous figure of 19th century, note the birth and the death dates, the birth and the death years, and calculate the lifespan of the person. So we now move on to the next slide. So we had discussed information overload, the concept of information overload. So I had told you that Metamend is a company that bills itself as a search engine marketing expert, and it infers from the number of web hosts that there are more than 371 billion pages of content on the web. So this is one example of the challenge that Epler and Menges, they are two information scientists, they call this as information overload. So they define information overload as a term which is often used to convey the simple notion of receiving too much information. So whenever you receive too much information, that condition is known as information overload. So how else would you feel inundated by information, right? So what are some general examples of information overload? How does a layman feel inundated by information? So first example is an increase in the number of television and cable channels that we've experienced over the past years. There are more than 800 channels now. Then the second example is that of an explosion of web pages. The third example is that of the search engine results, which often number in millions. So today, if a Google search on public health brings up more than 648 million results. If you put in public health as the keyword on Google, you will get more than 648 million results. Then the fourth example is that of exposure to commercials and advertising. They also bombard you with information. The fifth example is that of the piles of newspapers, magazines, and journals that are waiting to be read. And most of them end up not being read. So there are negative consequences of information overload to information overload. And what can be those negative consequences? So the most important negative consequence of information overload is a possible decrease in a person's ability to make good decisions, that is, to reach good decisions. Now, the information overload is depicted as an inverted U-curve, as you can see on the slide here. So as initially, with every bit of information increasing for a person, the decision accuracy improves or increases to a certain point, but till it reaches a peak. And beyond that peak, with every bit of increase in information, the decision accuracy falls drastically for that person. So beyond the point, once a person has reached his or her peak of information that the mind at his or her mind can process, beyond that point, if you keep on bombarding that person with more and more information, his decision accuracy for his or her decision accuracy falls down dramatically, and this phenomenon is known as information overload. So this is manifested in many ways. So how is it manifested? In what all ways is it manifested? So this is manifested by a person's difficulty, first of all, in identifying the relevant information, that out of these millions of results in front of me, which of this information is relevant for me. The second difficulty is becoming highly selective and ignoring a large amount of information, because you obviously cannot go through 648 million results if you have entered public health as a keyword. So you have to become highly selective and ignore a large amount of information. So how to become selective and ignore, which part to ignore? The third difficulty is in identifying the relationship between the details and the overall perspective. यानी एक वृहद चित्र में और उसके डिटेल्स में जो रिलेशनशिप है उसके बीच में संबंध स्थापित करने में उस व्यक्ति को दिक्कत होती है. The fourth difficulty is that that person needs more time to reach a decision because he or she is confused. He or she has been bombarded with so much information that now he or she is confused. So they need more time to reach a decision. And the fifth difficulty is that after all this, finally, they might not reach a decision of adequate accuracy. So whatever decision they come to or whatever decision they make is not of adequate accuracy, and there are chances of fallacies in those decisions. Similarly, these examples were for a layman or in general life, but in the professional literature for medicine and public health also, information overload is a similar problem. So here are some examples for medicine and public health. How does information overload become a problem in the field of medicine and public health? So the first example is that you know that medical knowledge doubles every 6 to 8 years with new medical procedures emerging every day. This is the first example. So how much can a human mind process? Second example is that because because of the nature of public health as a science. Public health, we know that is both interdisciplinary and multidisciplinary. Multidisciplinary means that to become an expert in public health or to become a good public health practitioner, you need to be expert in various sciences. That is environmental science, behavioral science, population sciences, human biology, epidemiology, biostatistics. So this is multidisciplinary. Whereas interdisciplinary means that besides gaining expertise in various sciences or various subjects, many new sciences or subjects are synthesized as a result of combination of two different sciences. For example, you have to be an expert in health to become a good public health practitioner, and you have to be an expert in economics. Plus, the synthesis of health and economics comes up with another new subject, an interdisciplinary subject, that is health economics, which deals with the economics of the health. So you have to be an expert in health economics as well. So because public health is both interdisciplinary and multidisciplinary, the information that you have to process or search in public health, that volume of the information and access to that information becomes a challenge as a public health student or a public health practitioner. The third example is that I have already given you this example, that when you a Google search on public health brings up more than 648 million results. So when you give or enter public health as the keyword in Google, it will bring you up with more than 648 million results. Similarly, a search on public health as a subject heading in Medline results in more than 3.5 million, more than 5.5 million citations. More than 5.5 million citations, can you imagine? So what is Medline? Let's discuss that. So the National Library of Medicine takes care of Medline, and it currently reports that Medline contains bibliographic citations and author abstracts from more than 7,000 biomedical journals published in the United States as well as 100 other countries. So the Medline database contains over more than 35 million citations dating back to the mid 1930s. But for such old citations that is dating back to the mid 1930s, they often do not have abstracts. And these numbers, besides these more than 35 million citations, these numbers compound when you look at other health databases, such as they are also considered, such as CINAHL. So CINAHL. So CINAHL, the full form of CINAHL is Cumulative Index of Nursing and Allied Health Literature. When you add CINAHL or PsycInfo, then the numbers compound even after considering the overlap in the citations. So this is what information overload is. Now we will come to the essential public health services and information literacy. We had discussed about the evidence-based medicine, right, in the last class. So you all must have heard the term evidence-based medicine. It is a widely used term that most people do not tend to understand. So technically, what is evidence-based medicine? Evidence-based medicine is decision-making. Decision-making based on what? Decision-making based on scientific reasoning and systematic uses of data and information systems. So if you are making systematic uses of data and information systems, and you are using scientific reasoning to come to a decision, and this decision is being used for individual health care, then this practice is known as evidence-based medicine. Now, while evidence-based medicine refers specifically to the clinical environment, that is, it is being practiced between the individual and the healthcare provider, the practice of the evidence-based practice has been expanded to other fields as well, such as evidence-based public health, evidence-based nursing, evidence-based librarianship, evidence-based management. The only difference is that here the decision-making based on scientific reasoning and systematic uses of data and information systems would be applied in the field of public health in case of evidence-based public health. In case of evidence-based nursing, it would be applied in the field of nursing. In case of evidence-based librarianship, it would be applied in the field of evidence-based in the field of library sciences. So let me give you technical explanations of all of these terms, that is evidence-based medicine and evidence-based public health at least. So the technical definition of evidence-based medicine is the conscientious, explicit, and judicious use of current best evidence, whatever evidence is available, in making decisions about the care of individual patients. On the contrary, evidence-based public health means effectively finding and evaluating answers to questions about populations and disease or health, making use of current best evidence. Right. So when evidence-based practice is done right, the evidence-based model is not just any use of information or any use of literature. It is the use of evaluated, reproducible evidence. So it is the use of evidence that has been evaluated, and it is the use of evidence which has been evaluated as well as is reproducible. That is, it can be reproduced by anyone, anywhere, anytime. So it has to be a reproducible evidence, not just one time. So in fact, the problems and approaches that public health practitioners deal with, since they are increasing in technical sophistication with time, with passage of time, it has been emphasized that an evidence-based approach is a must for public health to develop policy and interventions. You need to be aware of the current best available evidence to develop policy and develop interventions. So these problems and approaches that public health practitioners deal with have been categorized into essential public health services by a steering committee, and that steering committee included representatives from US public health service agencies and other major public health organizations around the world. So there are three broad categories of services in which public health services have been distributed. The three broad categories are assessment services, policy development services, and assurance services. So every one of these categories and the subsequent interventions therein are all dependent on appropriate use of information, which means that you cannot provide essential public health services in absence of information. So the public health workforce has a specially critical need, therefore, for information seeking skills. You must know how to seek information. You must be competent and possess information seeking skills and strategies to be a successful public health student and a successful public health practitioner. So let's move on to the next slide. So this slide depicts the core public health functions and essential services. So as you all can see, there are three broad categories of services: assessment services, policy development services, and assurance services. So assessment comprises of monitoring health, diagnosing and investigating health problems, then informing, educating, and empowering people, mobilizing community partnerships and action, developing policies and plans, enforcing laws and regulations. These are all 10 essential core services. Okay. Then linking people to or providing healthcare or public health care. Then assure competent workforce, both personnel as well as public health workforce. Then evaluate the effectiveness, accessibility, and quality of personnel and population-based health services. So let me again read it out for you. Research forms the core for all the three broad categories. That is, all the three broad categories have been divided into two sections. Then research and system management. So assessment services comprise of a research component and a system management component. Research forms the core of all the three basic categories, and whatever we learn from research is applied in system management. So the first of assessment services is monitor health. That is, monitor health status to identify and solve community health problems. Then the second assessment service is, the goal of the assessment services is diagnose and investigate health problems and health hazards in the community. The third assessment service is inform, educate, and empower people about health issues. Then we come to policy development services. There are two policy development services. That is, mobilize community partnerships and action to identify and solve health problems. Second one is develop policies and plans that support individual and community health efforts. Then we come to assurance services. It comprises of the first one under assurance services is enforce laws and regulations that protect health and ensure safety. Second is link people to needed personal health services and assure the provision of healthcare when otherwise unavailable. Eighth is assure competent public and personal healthcare workforce. And ninth is, after all, evaluation. You've done everything, now you have to evaluate whether it was effective or not. So evaluate effectiveness, accessibility, and quality of personal and population-based health services. At the core of all the three services is research. That is, research for new insights and innovative solutions to health problems. To become a competent public health worker, as well as a person competent in information seeking strategies, you need to be curious, persistent, analytical, as well as thoughtful. So these are the traits that are required for public health work and are also the traits needed in information seeking. Now, what does being curious mean? Being curious means that an inquisitive mind, that person has an inquisitive mind and an active desire to learn and to know. So if you think that you're curious, you must have an inquisitive mind, and you also must possess an active desire to learn and to know. So these are the attributes of a curious person. Now, what does being persistent mean? we know that getting answers is not always straightforward. It is not that you just put in the question, type in the question, and you will get an answer, especially when you're doing research work and research, evidence-based research work. So in that case, persistence means that you are not supposed to take answers at face value, but you are supposed to question and appraise those answers. This is what persistence means. So when you say that persistence is required for public health, you mean that the person concerned should not take answers at face value, but should question and appraise those answers. What does being analytical mean? Being analytical means that you have to think about it, think about the answer, and try to find out whether that answer is biased or unbiased. What does bias mean? Bias, as defined by Johns Hopkins Bloomberg School of Public Health, means it is the amount that we are off from the true value. So let's say the true value is 50 and we are placed at 60, then we are 10 points away from the true value. So we are 10 points biased. Similarly, if the true value is 50 and you are placed at 40, you are 10 points away from the true value. So you are 10 points biased. So the further you are from the true value, the more biased you are. The nearer you are to the true value, the less biased you are. So understanding what bias exists in the literature and making every effort to use all the available resources to remove that bias, to get rid of that bias, and to reach an unbiased answer is the difference between the novice and the professional. So this is all for the essential public health services. Now, we know that every area of public health research, from epidemiology to health policy, they all report their findings and opinions in the published literature. So the literature, though, is not similar for all, is not one size fits all. So it cannot be used in the same manner by everyone. And a generic difference is because differences exist in the literature, and this difference is a result of bias. We all are biased in our various fields, or towards our various fields, or against various fields. So as I told you, Johns Hopkins Bloomberg School of Public Health defines bias as the amount we are off from the true value. So it asks how wrong we are when we don't get it right. यानी अगर हम सही नहीं हैं तो हम कितने गलत हैं, ज्यादा गलत हैं या कम गलत हैं. अगर आप ज्यादा गलत हैं तो ज्यादा बायस्ड है, कम गलत है तो कम बायस्ड है. कोशिश है कि सही रहें. अब स्टडी डिजाइन और लिटरेचर रीडिंग के पर्सपेक्टिव से तो बायस एक वेल अंडरस्टूड टॉपिक है, लेकिन लिटरेचर सर्च अगर आप करना चाहते हैं, when you are performing literature searches and you are trying to access literature, the role of bias there is less well understood and less well defined. But you can get rid of the bias that you come across while searching literature and accessing literature by asking a simple question. In fact, two simple questions: that when was this information produced and how was this information produced? So how can these two questions help you in getting rid of the bias that might be present in the literature? Let's understand this with the help of an example. Let's say that an event happens. So in the last class, I had taken the example of the initiation of the pandemic from China, which then later became it initiated in the form of an outbreak in China, and then it later took the shape of a pandemic, COVID-19. So let's take another example in this class. Let's take example of 26/7 or the tsunamis of December 2004. So both of them were catastrophic events, although all events need not be traumatic. So when this happened, the December 2004 tsunami or the 26/11 incident, or the initiation of the pandemic, let's say initiation of the pandemic in India. When this happened, information about the event was created and disseminated. We all know that, we all have been through that. And the passage of time जैसे जैसे समय बीत रहा है या जब आपको जानकारी मिल रही है उस दौरान, when the information is being produced in relation to the event, as well as the medium, किस माध्यम से आपको जानकारी मिल रही है, it tells you a lot about the quality of the information. अगर वो जानकारी आपको न्यूज चैनल्स के माध्यम से मिल रही है, यानी उसको प्रिपेयर करने में जर्नलिस्ट्स और राइटर्स इन्वॉल्व होंगे. Those journalists or writers may or may not have expertise in the topic in health and public health. अगर वो जानकारी आपको peer reviewed journal से मिल रही है, इसका मतलब उस जानकारी को प्रिपेयर करने में या आप तक पहुंचाने में प्रैक्टिशनर्स, प्रोफेशनल्स, रिसर्चर्स इन्वॉल्व हैं, यानी वो इंफॉर्मेशन कम बायस्ड होगी as compared to the information that you would receive from news channels or newspapers or magazines. So when was the information created? As you are closer to an event, क्योंकि जानकारी कम होती है, the amount of information generated is less at that time. When COVID-19 became a pandemic, at that time, information about COVID-19 was not that much compared when we compare it with the amount of information on COVID-19 today. So obviously, when you are closer to an event, information generated is less and the authenticity of that information is less, thus thereby increasing the bias. As we move away from the event, as time passes and we move away from the event, research work, scholarly work, practitioners, they of course generate information and do a lot of research. So the bias, we gradually get rid of the bias and the real information comes up. So when you are closer to, what else can you find to expect when you are closer to an event? So when you are closer to an event, the information provided is simple. So let's move on to the next slide. When we are closer to an event, that is when event happens, the information provided is simple, general, who, what, where, when, and the sources are news sources like newspapers, news websites, and radio and television broadcasts. Authors, yeah, who are responsible for generating that information are generally journalists or writers who may or may not have any expertise in the article's topic. So there is a chance that there may be a lot of bias or wrong information. A week later, many popular magazines and other sources of news might come up. Again, the type of information would still be general and it would still be generated by journalists or writers who may or may not again have any expertise in the article's topic. A month later, professional magazines and more in-depth news reports and analysis would come. The type of information or the audience now would be professional or scholarly, because general public would not read professional magazines and in-depth news reports. And now the authors also have changed. They have changed from journalists or writers to, or people with little or no expertise, to professionals, experts, and scholars. So now the authors are practitioners or professionals who have at least some background in the topic. Several years later, the sources become scholarly books and journal articles and even reference works. And the type of information or the audience is researchers or experts. The authors, again, are researchers, scholars, or practitioners who are considered experts in the field, because general people or layman would not read journal articles. So when closer to the event itself, the information provided is simple. That is what, when, who. Typical sources for this general information are social networks like blogs or wikis, or news sources, that is cable news websites. So both are available through the World Wide Web. So let us understand what do we technically mean by sources and blogs or wikis. Let me give you technical definition of these terms. Just a second. Right. So by sources, we mean works, that is works that supply information or evidence. These works could be source books, data, document, material, study, etc. Sources, again, can be of three types: primary sources, secondary sources, and tertiary sources. The primary sources are the raw data of public health research. Primary sources, examples are census. Census data is primary source. Then the information generated by government ministries is raw data. So that is also a primary source. Primary sources are the raw data of, in context of public health, raw data of public health research. So data are collected on the population at all levels, that is local, state, and national, in order to assess, assure, and plan for the health of the nation. Then coming to secondary sources are research reports. They are not raw data. So a review article, for example, is a secondary source. Tertiary sources, again, are based on secondary sources. So they synthesize and explain research. The typical, when we are closer to an event, sources are social networks, blogs, wikis. Now, what do we mean by blogs or wikis? Blog is a short term for weblog. So of the word web, we only take the alphabet B, the last alphabet B, and ignore the first two alphabets WE. So B from web and log, L-O-G, log from log makes it blog. So it's a short term for weblog. Blogs are web pages that serve as a publicly accessible personal journal. For example, if I am writing a blog, it is my personal journal, which I am writing, but it can be publicly accessed. So it's blogs are web pages that serve as a publicly accessible personal journal for an individual. They are frequently updated depending upon how frequently the individual updates that blog, and often reflect the personality of the author. So if I am writing a blog, it will reflect my personality. If you are writing a blog, it will reflect your personality. A typical blog may combine text, whatever the person writes, or images, if the person is sharing certain images, or links to certain other things like some other blogs or web pages or other media, if the person wants to link certain other web pages to his or her blog. So this is what blog is. Now, what do we mean by wikis? You all must have heard about Wikipedia, and you all must have used it for search as well. So wikis are websites that allow visitors to easily add, remove, and otherwise edit the available content. So if it is a wiki, you can go to that website, you can add any information, remove any information, or edit any available content. So any user can do that. There is no foundation for that. So any user, I can do that, you can do that. You can go and edit the site content, including other users' contributions as well. And this can be done using a regular web browser. You don't need any sophisticated equipment or software. So this is what blogs and wikis are. So when we are closer to an event, the typical sources are social networks, blogs, wikis, or they can be news sources, that is cable news websites. Both of them are available to free World Wide Web. Nobody charges for them. So at least subscription charges are not there. So as more time passes, the type of author changes from those with little or no expertise. For example, here in the table, initially the type of author were journalists or writers who may or may not have any expertise in the article's topic. Later, they became researchers, scholars, or practitioners who are considered experts in the field. So with time, the type of author changes from those with little or no expertise to professionals, experts, and scholars. Now, bias is further limited through the use of peer review. Peer review, I have already told you, is a journal's policy to, whenever an article is submitted to a journal for publication, that journal might send that article to experts in that field or subject area for reviewing. So those reviewers or those experts in the field or subject area go through that article and verify whether sound research has been done, whether it is a high quality article or not. And if they find that it is a high quality article based on sound research, then only they allow it for publication in that journal. So peer review is a journal's policy to let every article that is submitted to that journal be reviewed by an expert panel before accepting it for publication. So this process assures that only high quality articles are published in that journal, which are based on sound research and which also offer a significant contribution to the field. So they only are included in the publication of that journal. So bias is removed through peer review, is limited through peer review. Footnotes, bibliographies, proper citations are given for each and every information that you're quoting. So what you find at the other end of the spectrum, at this end of the spectrum, there were authors with little or no expertise, so there could be a lot of bias in the information. At this end of the spectrum, after years after the event has occurred, it is true research being produced and disseminated. Okay. So we've quickly revisited what we had learned in the last class. Now we would move on to our next section. That is systems of information organization we'll go through today. And then we'll move on to practical skills in searching databases and searching the internet. So information is organized in three basic forms on internet. First is World Wide Web. So one of the advantages of using the web is its scope. Uska vistar bahut zyada hota hai. And the fact that such a wealth of information is available anywhere at any time makes it an attractive resource. कोई भी एक व्यक्ति या संस्था वेब को कंट्रोल नहीं करती है. So there is no one person or organization that controls the web or its content. And as a result, नतीजतन होता क्या है कि information unorganized or unstructured होती है. So as a result of this, the information is unorganized and unstructured. So those searching for information on the web, it often happens that they can spend hours searching for that information, which may or may not be available online. Now, besides this, because the web is organic, which means that the content is constantly being added, removed, or changed. So a site that is alive and well today may not be in existence tomorrow. Or either the information may have been changed or it may have been deleted. So if you have gotten any information from a website, and tomorrow if you go and visit the website and the website ceases to exist, then what are you supposed to do? So therefore, you must always take a careful note of a site's address, that is Uniform Resource Locator or URL. I'll show you how to do that. So let's type in something here, public health. So let's type in public health department. So public health engineering department, Haryana, India. So Jan Swasthya Abhiyantriki Vibhag, Haryana, public health engineering department, Haryana. Yesterday I had opened public health engineering department, Bihar. So this is the URL for this website. So next time if you want to visit this website, or if you have noted down any information or used any information from this web page, you have to refer to this URL, or that is https://phedharyana.gov.in/user login. So this is the URL that you have to refer to if you are quoting this information for any of your purposes. So this URL can provide documentation of this page for reference. Whenever you visit a site and get any information from there, note down any information, use any information from that web page, always note the URL for that website. Now I'll close this. Right. So not only is the web volatile in nature, that is the content is being modified or changed or added or removed every day. The quality control is also lacking. So anyone, anywhere, with any qualifications or none at all. For example, any person, any Tom, Dick and Harry, whether he or she is qualified to write on health or public health or not, he or she can construct a web page. So the quality control is lacking on free worldwide. Search engines, for example, Google is a search engine, Bing is a search engine. They search the free web. So which includes mostly pages published by companies or organizations or individuals. So there was a well-known cartoon published in the New Yorker magazine some years back, and that quoted, "On the internet, nobody knows you're a dog." So if you've published something on the internet, nobody knows how qualified you are to write that, and people take it at face value. So the cartoon referred to the anonymous nature of the web. So you have to be careful while referring to information from free World Wide Web. Now, another problem with World Wide Web is the information gained from free web is that we know that many online sources are more current than their print counterparts. So in terms of currency, of course, it is more current as compared to the print counterparts. Because when you consider the amount of time consumed if you're writing a textbook, so the time consumed in writing a textbook is huge. Then it involves time consumed in editing, revising, and then printing, and then publishing. So as compared to that, if you tend to publish a book on the web, it is more advantageous because items can be updated instantaneously and continuously. If you want to make a change in any text or information, you can always do that. Whereas if you want to make a change in a published textbook, you will have to go through the entire procedure once again, and a new edition has to come up. So although the web is useful for finding current information, one must not always assume that documents and web pages have been updated or revised in some time. For example, let me again go to the web and show you what do we mean by that. Right, so we type in public health department. Okay. Right, user login, public health engineering department. let us see when was this page constructed and when was it last updated. The information should be given here because this is a government website, state government website. Copyright 2018, Public Health Engineering Department, Haryana. Page last updated on 30/3/2021. Very good. So it was updated yesterday. This page was updated. So this page contains updated information. That much we can see because it was updated yesterday itself. However, when was this page created is not mentioned here. I guess it was created in 2018 because the copyright belongs to 2018. So this page was created in 2018, 3 years back, and it was last updated yesterday. So it is a well-kept and well-updated page. Now let us go back and look at the Public Health Open Public Health Engineering Department, and this is Public Health Engineering Department, Bihar. Let us open this web page. Public Health Engineering Department, Government of Bihar. So this page was last updated here. It is giving you the information. Last updated Friday, June 22nd, 2018. So it was last updated 3 years back, which means that this page is not, this website is not well kept and it is not being updated regularly. So it contains outdated information. It was copyright is of 2018, so which means it was created 3 years back and then only it was last updated in June 22nd, 2018. After that, this web page is not being kept and updated at all. So you cannot rely on the information that this web page is providing. However, you can very much rely on the information provided on the Public Health Engineering Department, Government of Haryana page, because that page is well kept and updated. So you must always, whenever visiting a website, please always check that you note the date and a site, the date that the site or document was created, along with the date that the page was revised or updated. So any page that lacks such information should be used with extreme caution. Now, because a lot of material is available on free web, and it is available, not just available, but it is freely available, and it is quick and easy to use, we often get tempted to simply turn to the web for our research needs. But since we are now aware that information on the web can be extremely biased, so from now onwards, we will be more discerning and critical of what we find on the web and how is it used. Okay. So the next information organization system is that of gray literature. So the one is the freely available information on the free web, World Wide Web. The second format is that of gray literature. And this format is often overlooked. What does gray literature mean? Gray literature is defined as literature that is not produced or distributed by commercial publishers. So let me give you a technical definition of the term gray literature. It is material disseminated outside of the traditional peer-reviewed journal or scholarly work. Examples include conference papers, newsletters, research reports, and position papers. As some researchers do not submit their work to scholarly journals, gray literature may be the only source in which their research can be located. So many government websites, people from academia or government or non-profit organizations, they also generate a lot of activity information activity-related information and research related information, but they do not always send it to scholarly journals for publication. And that information is reliable as well. So where to look for that information? Because this information is very noteworthy for public health. Because public health is an interdisciplinary profession, as we have already discussed that. A significant amount of public health information is generated through academia, governmental and non-profit organizations. Now, since they do not always send their information that they've generated to scholarly journals for publication, and you cannot rely on the information that is found on free web, where to look for this information? So this information or this format is known as gray literature. It can be in the form of program reports, newsletters, conference proceedings, meeting notes, and abstracts. It can also be in the form of interviews, data sets, policy briefs, and other formats. Now, this type of information, because it is not usually indexed by databases, as it is not published by scholarly journals, so you would not find this information on Medline database, for example, or Global Health, for example. And often web is the only place gray literature is available. Now, how do you identify on the web, how do you identify or differentiate between gray literature and just any information? That is the biggest challenge. So due to its volume, diversity, and non-traditional formats, greatest challenge involved with gray literature is its identification. So there is limited indexing and acquisition of this literature by the libraries. So only a public health student or a worker who is persistent enough will be aware that gray literature exists and will make every effort to find relevant sources. Now, New York Academy of Medicine NYAM library used to collect gray literature. It used to make collections of gray literature and provide it to public via gateways. That is its gateway of New York Academy of Medicine library. It used to publish quarterly gray literature reports, which means that 4 times in a year, it used to publish gray literature reports. So it used to do that from 1999 to 2016, but in 2016, it stopped collecting gray literature. And since then, there is no formal gateway or collection of gray literature. People have to search gray literature for themselves only. Although the archives from 1999 to 2016 archives is available on the New York Academy of Medicine website. So despite the difficulties in identifying and accessing gray literature, the public health students and practitioners must keep their importance in mind. Now, why is it important and how is it important? The first reason why it is important to a public health student or practitioner is because it enables a public health student or practitioner to learn and build on the activities and research of other professionals in the field. It also provides examples of successful assessments or interventions to stakeholders or constituents. If any non-profit organization or government has carried out any program or initiative for a successful assessment or intervention program, then you can learn from that also. And third is it provides support for policy and decision making. You can learn a lot while do a decision or while designing a policy. If you take help of gray literature, what people have already done, what information they have created, then it would help you in policy and decision making as well. So the third, we will understand all this through the examples of case studies that we will discuss today. The third format is the scientific database format, the example for which is the Medline database. So we've discussed the pre-World Wide Web, the gray literature format, and now we are discussing the scientific bibliographic database format, for which the primary example is Medline database for health and public health, of course. So the Medline database is maintained by the National Library of Medicine, as we have already discussed. National Library of Medicine belongs to the government of USA. So it is the most widely used database for searching the biomedical literature. And this Medline database contains over 35 million references to journal articles in biomedicine and health. But not only does it contain journal articles in biomedicine and health, it also has a broad coverage of public health, health policy development, behavior sciences, and other fields as well. So most publications that are indexed for Medline are scholarly journals. They do not index, of course, gray literature. And their coverage goes back to the 1930s. This I had told you earlier. So although abstracts are often not available for that old literature. So Medline is available through 2 sources. First, that Medline is available through commercial vendors also, for example, Ovid Technologies, and it is also freely available to the public via PubMed. So this question might come up in your mind that if Medline is freely available to the public via PubMed, why access Medline through a commercial vendor such as Ovid? The importance of accessing Medline or PubMed through a commercial vendors such as Ovid Technologies is that when you are performing searches or you're trying to seek information on PubMed via Ovid Technologies, It helps you in information seeking. It helps you in maintaining history of your searches. It helps you in selecting keywords as well as organizing your references and bibliographies. So that is one advantage, but you have to pay for it. Otherwise, it is freely available to the public via PubMed. And public health students either may have access to PubMed via their university library subscription, or they can access PubMed on the web at http://www.pubmed.gov. So now we will discuss the 3 case studies. We will discuss only one case study because there is not enough time to discuss all the 3 case studies. Although there are 3 case studies available. First case that I've come across, and first case study belongs to the essential public health service category of assessment. Then the second case study belongs to the service category of assurance, and the third case study belongs to the service category of policy development. Remember the slides, this slide. So first case study belongs to the assessment category of services. The second case study belongs to the assurance category of services. And the third case study belongs to the policy development category of services. So today we'll discuss only the assessment category of services case study. So each essential public health services category, that is assessment, assurance, and policy development. Just a second. Right. Is an information intensive activity. We know that you need information for all of these 3 activities. Now, the first case study illustrates an assessment activity. So it profiles the US Public Health Service. US Public Health Service is an organization in the United States which looks after the public health service of their country. So the US Public Health Service, this case study belongs to the 1950s, the mid-1950s, when in the 1950s, the US Public Health Service started to look for a link between tobacco and health. And the background for that was, in 1956 to 1961, there was a Surgeon General of the United States Surgeon General for the US Public Health Service named Dr. Leroy E. Burney. Dr. Burney, during his tenure from 1956 to 1961, when he was Surgeon General of the United States Public Health Service, he was aware of a growing body of research that examined the effect of tobacco smoke on human health, and he was very much interested in this body of research. This research consistently showed an association between cigarette smoking and lung cancer and other forms of related morbidity. So, under the auspices of the United States Surgeon General, that is the Office of the United States Surgeon General, which Dr. Burney was occupying at that time, he organized a scientific study group in June 1956. And that scientific study group consisted of 7 members, and it was led, that 7-member scientific study group was led by a biochemist, Dr. Frank M. Strong, who was a professor of biochemistry in University of Wisconsin. So this scientific study group was also sponsored by 4 national institutes of US, health institutes of US. The first was National Cancer Institute. The second was the National Heart Institute. The third was the American Cancer Society. And the fourth was the American Heart Association. So all 4 organizations, they sponsored the study group along with the Office of the United States Surgeon General and the US Public Health Service. So this 7-member group began its study. And what was the purpose of creating this group? So the purpose of creating this study group was to review the problem, that is the effect of tobacco smoke on human health, and to recommend further avenues of research on this topic or problem. So what they did is the study group held 6 conferences, and all of these conferences were 2-day conferences, and these conferences were held to review what was known about it, what was already known, or what was being known currently about the effects of tobacco smoking on human health. So to achieve this objective, they examined published literature. The study group examined published literature, unpublished literature, and consulted with experts. So they examined the bibliographic database, that is published literature. They examined the gray literature, that is the unpublished literature, and they also consulted the experts. Now, they prepared a bibliography they prepared a report at the end of their research, and that report was titled Joint Report on Smoking and Health, and it was published in 1957. So June 1956, this group was organized, study group was organized, and on June 7, 1957, their joint report on smoking and health was published in the journal Science. So in the bibliography to this report, that is joint report on smoking and health, it included 76 references, 76 references थे उसमें. अब न सिर्फ ये काफी ज्यादा references हैं, 76 is a large number of references, but there was also a significant amount of depth to these references, which means that the references spanned 31 years. 31 सालों को span करते हुए references थे. 31 years, which means the references started from 1926 and covered till 1957 when the report was published. So the references included references starting from 1926 to 1957, and in 1957 the report was published. So they included references that were 31 years old, as well as the latest references that were published just 1 or 2 or a few months back when the report was published in the journal Science. So not only did they span references of 31 years, they included English and non-English language publications as well. That is French, German, Russian, Spanish, Italian. So whatever good publications they came across, they included all those publications. Then they included unpublished data, that's gray literature, reliable gray literature that they came across, as well as results from human and animal studies that were available to them. So after reviewing the available evidence, so they were very comprehensive in their approach. And after reviewing the available evidence that was available for the reader, the study group concluded, in the end, they mentioned that the sum total of scientific evidence establishes, I'm verbatim reading what they had mentioned in their report, the sum total of scientific evidence establishes beyond a reasonable doubt that cigarette smoking is a causative factor in the rapidly increasing incidence of human epidermoid carcinoma of the lung. So they said that it has been established after going through all the available evidence so far in the last 31 years, it is being established beyond a reasonable doubt, बिना किसी संदेह के ये स्थापित होता है कि सिगरेट स्मोकिंग यानी धूम्रपान, सिगरेट स्मोक करना एपिडर्मोइड मानव में होने वाले एपिडर्मोइड कार्सिनोमा ऑफ द लंग के लिए एक कॉजेटिव फैक्टर है, और इसके बढ़ते हुए रैपिडली इंक्रीजिंग इंसिडेंस यानी नए आने वाले बढ़ते हुए केसेस के लिए सिगरेट स्मोकिंग ही जिम्मेदार है, एक कॉजेटिव फैक्टर है. तो ये उसका बहुत बड़ा कारण है. बढ़ते हुए ह्यूमन एपिडर्मोइड कार्सिनोमा ऑफ द लंग के केसेस के लिए सिगरेट स्मोकिंग एक बहुत बड़ा कारण है. ऐसा इस नतीजे पर इस स्टडी के बाद ये स्टडी ग्रुप पहुंचे. अब ये जून 7, 1957 में ये साइंस जर्नल में पब्लिश हुई थी ये जॉइंट रिपोर्ट, और ठीक इसके बाद डॉक्टर बर्नी, जो कि यूएस सर्जन जनरल थे यूएस पब्लिक हेल्थ सर्विस के, उस वक्त उन्होंने एक स्टेटमेंट जारी किया जिस स्टेटमेंट का टाइटल था स्मोकिंग एंड लंग कैंसर. सो इन अ स्टेटमेंट डॉक्टर बर्नी सेड दैट द पब्लिक हेल्थ सर्विस is deeply, public health service means he referred to the US public health service, and the public health service is deeply concerned with the increasing death rate from lung cancer in the United States and in other parts of the world. So we've already studied death rate in the class. So he said that the USPHS, US Public Health Service, is deeply concerned with the increasing death rate, बढ़ती हुई मृत्यु दर, जो कि लंग कैंसर की वजह से बढ़ रही है. लंग कैंसर से होने वाली मृत्यु दर में बढ़ोतरी की वजह से जो यूनाइटेड स्टेट्स में और दुनिया की दूसरे हिस्सों में हो रही है जो बढ़ोतरी मृत्यु दर में, उससे यूएस पब्लिक हेल्थ सर्विस बहुत चिंतित है, और नंबर्स एक्चुअली काफी स्ट्राइकिंग थे. सो ही सेड दैट इन 1930 में the death rate from lung cancer for white males was 3.8 per 100,000 population or per 1 lakh population. So in 1930, the death rate from lung cancer for white males was, out of every 1 lakh white men, 3.8 on an average, 3.8 white men died of lung cancer, died from lung cancer. And by 1956, that death rate rose to 31 per 1 lakh. So whereas in 1930, only 3.8 white men were dying from lung cancer per 1 lakh population. By 1956, it was 30 white men dying per 1 lakh white men in 1956. So it was a 700% increase in the incidence of lung cancer in 26 years, which was a huge increase. And the study group had already reported that the causative factor for this increase in incidence was cigarette smoking. So Dr. Burney concluded his statement by saying that it is a statutory responsibility of the public health service, यानी ये कानूनी जिम्मेदारी बनती है public health service की, to inform members of the medical profession and the public on all matters relating to important public health issues. So Dr. Burney concluded the statement by saying that we recognize our statutory responsibility that as US Public Health Service, it is our responsibility to inform not just the members of the medical profession, but also the general public of any such important issue relating to public health. And the relationship between smoking and lung cancer is one such relationship or one such issue, and therefore it falls with the responsibility of the public health service. Now here, आप गौर करेंगे कि goals of assessment services के 3 goals हमारे सामने ये slide में है: monitoring health, diagnosing and investigating health problems, and informing, educating, and empowering people. So the work done by the US Surgeon General, that is Dr. Burney, and the identification and the quantification of the problem by the US Public Health Service and the study group in this case study are evidence of all 3 of these activities. So they were trying to monitor health of the population. They were trying to diagnose and investigate the extent of the problem, and they tried in the end, after reaching to a good scientific conclusion, they tried to inform, educate, and empower the public to how to avoid or how to remove or get rid of those problems. So the importance of information seeking skills and access to literature is clear from this case study. The study group members knew how to seek information, how to strategize information, how to use information to their advantage, and they were very comprehensive in their approach. And not only did they had information seeking skills, they also had access to literature. So the importance of information seeking skills and access to literature is clear in this case. Okay. So now we are not going to discuss the other 2 case studies. I'll, if time permits in the next class, we might discuss these 2 case studies. Now we'll move on to practical skills in searching the literature, how to search the literature. We've already gone through enough of theory. So by now you must be feeling empowered to conduct expert searches. I hope so, so that you can meet your educational and professional obligations. And we've already gone through the theory behind the creation and dissemination of information, as well as how to determine its bias and value. So now we'll start learning the practical skills for finding and using public health information. Now we know that since public health is a multidisciplinary as well as an interdisciplinary field, so answers to public health questions might be found across a multiplicity of disciplines. For example, education, psychology, medicine, as well as from a range of sources. So the source could be primary source, secondary source, tertiary source, etc. So if we know the fundamentals of searching, we will know where to search, kahan jankari प्राप्त करनी है, kahan जाना है जानकारी प्राप्त करने के लिए. We will have a better idea of what we need because we are now familiar with the fundamentals of searching, and most importantly, we will be able to apply the skill in a multidisciplinary setting. So let's start with the practical skills. So first, we will learn how to search the bibliographic database, and thereafter we will learn how to successfully conduct a research on internet. So first, we will do scientific database, bibliographic database searching. What steps are involved in bibliographic database searching and how to go about it. So there are 7 steps used to conduct an effective database search, and I will just enumerate the steps and we will take an example. Let's say that we have to conduct a study on our research topic is cardiovascular disease prevention in women. So you have to make a secondary data research report on cardiovascular disease prevention in women, which you have to do in your 4th semester. So the first step in bibliographic database searching is we have to define the topic. What is our topic of research? So we've defined the topic. in this example, we've taken our topic is cardiovascular disease prevention in women. So you are interested in, which means that you are interested in researching cardiovascular disease prevention in women, and you would like to find primary and secondary sources of a scholarly value to start with your search. So the second step involves you define the topic. First step was define the topic. The second step is select database or databases to search. So you might need only one database, or you might need a number of databases to search. So we will select databases to search. So we need primary and secondary sources of databases, or primary or secondary sources of scholarly value. So the primary sources are census database, then the Ministry of Health and Family Welfare information database, Ministry of Home Affairs information database on health and public health. Till 2012, Ministry of Home Affairs in India used to take care of related data on health and public health. Then the Office of Registrar General, Census Commissioner and Registrar General of India also takes care of some health and public health related information in India. So all these databases, plus some CDC India Centers for Disease Control and Prevention works in India as well. So their database also gives you some information on health and public health. All these are primary sources of scholarly value. Then we move on to secondary sources. Secondary sources could be our bibliographic databases such as Medline, CINAHL, Library Catalog, PsycInfo, etc. PsycInfo would not be a good database in this case because we are not dealing with any psychological issues or psychiatric disorders, because we are dealing with cardiovascular disease prevention. So Medline, CINAHL, and Library Catalog would do for us in this case. So then the third step is, out of the 7 steps, we are done with the 2 steps, defining the topic and selecting database or databases to search. Then the third topic is choose the search topic. You have defined your topic. Now, what are the keywords or the controlled vocabulary you would use to search? That you have to choose. So let's choose our search topics, that is keywords and controlled vocabulary. So we will make 2-3 concepts to search, or keywords to search. The concept 1 would be, since our topic is cardiovascular disease prevention in women, our concept 1 or keyword would be cardiovascular diseases. So I will put in cardiovascular diseases in PubMed to search. So let me show you. Let me go to PubMed. PubMed. So I will put in cardiovascular diseases. Let us see how many. So it comes up with cardiovascular. When I put in cardiovascular diseases as first concept of the keyword, it comes up with more than 2.5 million results. Okay. And let me do all the searches, and then I'll show you how to go to history, how to access history in PubMed. Then let me save this. Cardiovascular diseases, save. All results. So it'll save only the first 10,000 citations. And the format would be summary text, create file. You can create file for all these citations. And it will create a file and save on your computer or laptop or desktop or laptop. So then let me move on to the second keyword. Let me take, since my research topic is cardiovascular disease prevention in women, or your research topic is cardiovascular disease prevention in women, let me take the second keyword as women's health or women health. Women's health. So in this case, it comes up with more than 157,000 results. I'll again try to save it for future reference. All results, create file. Okay. Then let me take the third keyword as, since it is cardiovascular disease prevention in women, let me choose the third keyword as, before starting your search, you have to choose your keywords. I'm just simultaneously showing you how to do the search, but you have to first choose your keywords carefully and then do the search. The third keyword that I might take is primary prevention. So here it comes up with more than 308,000 results. I'll again try to save it for future reference. My fourth keyword would be, now I'll try and combine all of these keywords. So I'll combine the searches, and my first keyword was cardiovascular diseases. So I'll put cardiovascular diseases. And so and is a Boolean operator. I'll let you know about it later. Women's health. All three searches, I'll combine all the three searches that I had done individually. Women's health and, or let me just do the search with these two keywords only, cardiovascular diseases and women's health. So now it limits the search because it will only come up with articles which deal with cardiovascular diseases as well as women's health together. So not the articles that individually deal with cardiovascular diseases and the articles that individually deal with women's health. So this time I've used the Boolean operator and whatever articles deal with cardiovascular diseases as well as women's health, only those articles would come up in my results. So now the search has been limited and there would be fewer hits, that is more than 13,000 results. I'll again try to save it. All results, create one. So only the first 10,000 citations would be saved in each case. Then I will move on to cardiovascular diseases and primary prevention. Now it comes up with more than 40,000 results, and again save it. Now I move on to women's health and primary prevention. So articles dealing with women's health and primary prevention are only 6,089. So it has come up with more than 6,000 results now. So I'll again save it. Okay, it will save it. Now, what I'll do is I'll combine all the three keywords and do the search. Cardiovascular diseases. And women's health and primary prevention. So now I've limited this search, combining the three keywords has limited the search, and now it comes up with only more than 1,200 results, because now it will come up only with those articles which deal with cardiovascular diseases as well as women's health as well as primary prevention. So now my search results is limited to 1,252 results. Now, if I want to limit my results further, because I cannot go through 1,252 results, so therefore, in the fourth step, so I've chosen my search topics, keywords, and controlled vocabulary. Then in the fourth step, you do what I just did, that is perform individual searches and then combine the terms and do the search. So in this example, the search was conducted in the PubMed database for Medline. Okay, so PubMed is the search engine for Medline. So it searches the Medline database only. So after doing the fourth step, we move on to the fifth step. That is, I have come up with 1,252 results after combining all the key terms, doing the combined search. Now I want to further limit my results, the retrieved results. So let me set the limit. I want to set the limit to English language articles only, because I won't be able to understand French or German or Spanish or Russian. So anyway, they would be useless for me. So let me set the language filter. Additional filters, language. Language, let me choose English. English. Show. Language, English. Right. So filter applied is English. So it was initially showing 1,252 results. Now the limits are limited, results are limited to 1,225. So all those articles which were belonging to non-English language, they have been removed. Now I further want to limit my retrieved results, and I want to limit myself to human studies only. Results dealing with humans, not animal studies or cell culture studies. So then additional filters, species, humans. Sure. Now the filters applied are English and humans as well. And now the results are further limited to 1,181. So it has removed all other results that came from animal studies or cell culture or otherwise, some other model systems. And now I further want to limit my results because 1,181 is still a big number. So I will limit the years searched. So let me, since it is searching from 1987, the results by year that it is giving here is from, it covers all references from 1987 to 2021. Let me limit the years that I'm interested in. So custom range, start date, I will take as year is 2011, month January 01, and date 01. So 1st January 2011 to 2021. 2021. This is date 31st. Today is 31st March 2021. So I'll apply. So from 1st January 2011 to articles published till then, apply. So these are the filters applied. Humans, English language from 2011, from 1/1/2011 to 31/3/2021. So now it has, now I have limited my search results, and now I'm left with only 791 results. So these are 791 results. They are still, it is still a long list of 791 results. So what I can do is, for the time being, what I'll do is that I will limit my search to those articles for which free full text is available, because I do not have a library subscription. So I will limit my search to free full text, for which articles are freely available. So after that, I am left with only 509 results. I further want to limit my search. So what I'll do is, I'll limit first my search to reviews. I will first go through some good reviews, and then using those reviews, I will go back to original articles, whatever good original articles are mentioned in those reviews. So now I'm left with just 69 results, and 69 is not a big number. I'll save this result. All results on this page, all results. Summary text, create file. After applying all the filters, now let me open this, open file. So this is how you will get a summary listing. I will go through all of these 69 reviews. Go through the abstracts of these 69 reviews. This list is available with me. I will go through the abstracts of all these 69 reviews. Fruit and vegetable intake and the risk of cardiovascular disease, total cancer and all-cause mortality, a systematic review and dose-response meta-analysis of prospective studies. So I will go through the abstract, that is, it will let me have an idea of the background, methods and results, conclusions, and the keywords that were used. And thereafter, if I find this interesting, I will read this review because full text article is full text is available for it. So I don't have to subscribe to any journal to access this article. So once I've gone through these 69 results, I will search some useful papers, and the sixth step is that of reviewing the results. So I've gotten 69 results. Now there are 69 results matching the search terms and limits applied in this case. And for most articles, the bibliographic information, author, title, source, and the abstract are available. And I've limited my search to 3 full text. So for some, the full text is linked here as well. So I will go through these 69 results and reviews, of course, and then I will select a good 10 reviews out of these 69 reviews and read them. And I would use those 10 good reviews to go back to the original articles mentioned in those 10 good reviews. So after that, the 7th step is selecting the results that will best answer the question. So out of these 69 results, I will select some 10 good results which best answer my question, that is cardiovascular disease prevention in women. So after searching this, these 10 results, I will go back to these, I will read these 10 results in detail and then go back to some original articles, good original articles that are mentioned in these reviews. This is the result that I have got in bibliographic database searching, that is Medline. This is an example of searching the Medline or PubMed. Now, I have not yet searched any primary source database. So let me go to a primary source database for cardiovascular disease prevention in women. Let me show you how to go about it. So let me search some Gray literature. Cardiovascular disease prevention in women. Government of India. Government of India. Cardiovascular disease prevention in women government. See, it has come up. Cardiovascular disease prevention in women and Government of India has come up with more than 19 million results. More than 19 million results. Or not more than 19 million results. It has come up with exactly 19 million results. So prevention of cardiovascular disease in women. This is a PubMed article. I think citing the Government of India work. This is not Gray literature. This is prevention of cardiovascular diseases in India. This is again available through ResearchGate. So this is also a publication, scientific publication, peer-reviewed journal. Cardiovascular diseases in India, circulation. This is American Heart Association journal. These are all scholarly journals. This is a Gray example of a Gray literature. Published by Ministry of Health and Family Welfare, Government of India. Guidelines for prevention and management of stroke, which is a cardiovascular disease. Non-communicable diseases, National Health Portal of India. National Program for Prevention and Control of Cancer, Diabetes. This is again Gray literature. This is Gray literature. Fact sheet, worldheartfederation.org. Grey literature, cardiovascular diseases in India. CDC in India, Centers for Disease Control and Prevention. Okay. Oh, can't reach this page. This is a scholarly article from Journal of Clinical and Preventive Cardiology, and this would have come up in PubMed as well. So I'll close this here. Cardiovascular diseases in India, current epidemiology and future directions. This is again American Heart Association, a journal from American Heart Association Journal, Circulation. So this again would have come up in PubMed search. So I'll close it here. This is an example of grey literature. So a literature that has been prepared by the Government of India, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, that is NPCDs, Guidelines for Prevention and Management of Stroke. So it deals only with prevention and management of stroke, not in general with cardiovascular diseases. Major risk factors of stroke, primary prevention. So similarly, one such report should also be available for cardiovascular disease prevention. I'll search that. Okay, so we download this. I'll print this. See. Guidelines for prevention and management of stroke. Documents. See. Right. Non-communicable diseases and their risk factors. This is again available on the National Health Portal of the Government of India. I'll go through it later. Then National Program for Prevention and Control, NPCDCS, program background, NHM components. These are all examples of grey literature. World Heart Federation, fact sheet, cardiovascular diseases globally in India, taking action. And this is by in footnotes below. So the source is World Health Organization. CDC Global Health India. Anyway, so this is how you go about it. And you can also do a search of the library catalog to identify relevant books for you, which will be helpful for you to answer your research question. Now, since we've learned the steps in bibliographic database searching, we'll now move on to steps to successful internet research. So there are 4 important steps to successful internet research. See, we know that in addition to database searching, many of us, students as well as practitioners, would turn to information on the web. So there are steps to an effective internet search, and just as there were steps to an effective database search that we just learned. So before we begin searching the web, we need to ask ourselves an important question. That is the web a right tool for us to use for our research topic? Now, we have to remember that only a small amount of professional, scholarly, or scientific information is available through the free web. Depending on what type of information we are searching for, would a textbook or a journal article or web be better suited to our needs? That is a question that we need to ask to ourselves, and then only do the internet search. So there are 4 steps to conduct an effective internet search. The first one is using the appropriate search tool. Using the appropriate search tool means that you have to use either search engines or meta search engines or directories, and all of them may result in different results. So you must know the differences between the various search engines, and therefore you may try searching using different search engines and try and compare the results that you receive in both of them. And if there is a difference in the results obtained from 2 search engines or meta search engines or directories, then you try searching more of them, more than one of them. Then the second step in doing an effective internet search is using the appropriate search techniques. What do we mean by this? Now, this step is the most important in differentiating between a novice searcher and an experienced searcher. Now, like searching a database, while searching a database, you need to be familiar with the database search engines interface. So similarly, while doing a search of the internet on a search engine, you need to be familiar with the search engine's interface and its rules of use. For example, is the search engine case sensitive? If it is case sensitive, then you have to take care of the cases. Can you limit your search to certain domains such as .gov.in or .edu or .gov.org, or it just gives you a mix of .com and .edu, .org, all the results? Or can you use quotation marks to search for a phrase? Then the third step is using the correct Boolean operators. Now, there are 3 primary Boolean operators: and, or, and not. And, or, and not, not. So while doing the search on PubMed, I had used and Boolean operator. So when you use and, it narrows the search, because when I used cardiovascular diseases, it came up with a long list of articles. Then when I used only women's health, it came up with a long list of articles. But when I combined both the key terms, that is cardiovascular diseases, AND, and women's health, so now it will only come up with those articles that deal with cardiovascular diseases as well as women's health. So this, using the and Boolean operator, narrows the search and it results in fewer hits. When you use or Boolean operator, if I would have used cardiovascular diseases or women's health, then it would have combined all those articles that deal with cardiovascular diseases as well as those articles that deal with women's health independently, and would have come up with a huge list of articles. So this broadens the search and therefore results in more hits. When you use the Boolean operator not, for example, if I use Boolean operator not between cardiovascular diseases, so cardiovascular diseases not women's health, so it will restrict my search to only those articles related to cardiovascular diseases which do not deal with women's health. So it will remove those articles of cardiovascular diseases from my list which are dealing with women's health. So it will very narrowly, or it will restrict my search to only those articles which deal with cardiovascular diseases but which do not deal with women's health at the same time. So, but you have to be careful, because while using not Boolean operator, you might easily exclude some relevant hits which you would not want to miss otherwise. So what are Boolean operators? I'll give you the technical definition of Boolean operators. So Boolean operators were named after the British mathematician George Frederick Boole, and his birth year was 1815 and his death year was 1864. Please note down the birth and death years. George Frederick Boole, also was a prominent figure of 19th century. His birth year was 1815 and death year was 1864. And please calculate the lifespan of this prominent figure of 19th century. You have to do this exercise for some 10, 20 figures of 19th century, and then we'll calculate the average lifespan of the prominent figures of 19th century. Then I'm giving you this task for a specific purpose. Once you complete this task, then let me know. So you don't have to do it right now. You may take your time and complete this task. So George Frederick Boole developed a system of logic to show the relationship among terms or concepts. And there are he came up with three primary Boolean operators, and, or, and not, which can be used to group search terms when conducting a literature search. So you have to use the correct Boolean operators. So search engine, because search engines are built and maintained by different companies, vastly different companies, and they are often competitors. For example, Google and Bing are competitors. So therefore, they do not all look or work the same. So you have to be familiar by doing an effective internet search. You have to be familiar with how your search engine works so that you know what operators are allowed and recognized. For example, while doing a Google search, I do not need to put in and between the terms cardiovascular disease prevention in women because I did not use that. But Google automatically inserts and between each term. So if you use and, it comes up that let me show you. Google. Let me go to Google. Cardiovascular disease and women's and women's. So it comes up with more than 92 million results on cardiovascular diseases and women's health. So it is not mentioned here, but generally when you insert, and I don't know why there is not insert mentioned here, but generally when you use and in your Google search, it tells you that the and operator is unnecessary, or I think Google has made a policy that now it does not even tell you that you do not need to insert and. So earlier it used to tell that the and operator is unnecessary as Google includes all search terms by default. So most search engines, they have a help section or about a section, or sorry, about section. For example, let me check with Google. See, here it has an about section or how the search works. So you go through, if you want to use a search engine for your professional work, go through how the search algorithms are used, how the information is organized, the overview, and what are the useful responses. And it'll help you how to perform better searches. So go through this section, how the search works, and also read the about section here about Google. So it'll help you better organize your searches. Right. So the fourth step in doing an effective internet search is evaluating the search results. So you need to think critically about any information that you use in your professional or academic work, because it is a necessity, even more so when you find that information in the web, because that information need not be reliable always. So be sure to consider how do you evaluate in internet resources by using 5 terms, that is A, B, C, D, E. A is for authority, B is for bias, C is for currency, D is for design, and E is for evaluate or evaluation. So first, evaluate the authority, that is who wrote the information, what are their credentials, are the information sources cited or not. Then check the domain, whether it is .gov, .org, or .edu, .edu versus .com. Please don't rely on .com websites. Then the second step is bias. Evaluate the bias. Who sponsors the site? Do they have a financial interest? Is there a conflict of interest? Are there ads present? The third step is currency. C for currency, A, B, C, D, E. So evaluate the currency, or how current is the information. When was the information published? When was it updated? More. So this checking currency is more important in some areas. For example, related to any laws or legislation or any drug related information, because they are updated frequently. And it could be less important in other areas like developmental milestones, or if you're dealing with anatomy. So even if those information are not updated recently, it will do. So then we move on to the next step, that is D. D for design. You have to evaluate the design of the website. Is it easy to navigate the website? Is the information well organized? Are all the links working and current? So then you move to the final step in evaluating an internet resource, that is evaluate. E for evaluate. A, B, C, D is done. Then E for evaluate. So evaluate, is the information clear and easy to understand? Is it in English or any other language that you read? Is the information fact or is the information an opinion? And cite all your sources. So this is all with information seeking strategies in public health. Now, I wish I could have taken an offline class for this, because then we would have used the internet and the computer system, and we would have practiced a little information seeking skills or strategies. But since that is not possible now, so this is where I finish my class, this class of today. So since I've recorded this class, I'll soon upload it on the YouTube. Okay. Thank you. Bye.